Chapter 4, Safety and Infection Control. By the end of Chapter 4, you should be able to explain the safety policies and procedures that must be followed in specimen collection and transportation. Define the term healthcare-associated nosocomial infection. Identify the basics of safety, infection control, and isolation procedures. Explain the proper techniques for hand washing, gowning, gloving, masking, double bagging, and entering and exiting the various isolation areas. Identify steps to avoid transmission of blood-borne pathogens, BBP, and reduce risks of BBP accidental needle sticks. Explain the measures that should be taken for fire, electrical, radiation, and chemical safety in a healthcare facility. Describe the essential elements of a disaster emergency plan for a healthcare facility. List 3 precautions that can reduce the risk of injury to patients. Safety and infection control. Goal of safety for healthcare facilities. Get rid of hazards to patients and employees. Provide safety education. OSHA CDC developed safe working guidelines for healthcare facilities and employees. Practice universal precautions to prevent acquiring blood-borne pathogens, BBP, such as hepatitis A, B, C, D, E, viruses, HIV, syphilis, and malaria. Wear gloves and other personal protective equipment, PPE. Place warning labels on containers that contain blood or potentially infectious materials. Please see Table 4-1 in your textbook. This is the label for the biohazard. As you can see in Figure 4-2, the label for the biohazard. Personal safety from infection during specimen handling, exposure control. Injured healthcare workers should immediately cleanse the area with isopropyl alcohol and apply an adhesive bandage if a needle stick occurs. Report all accidents immediately to a supervisor. Healthcare-associated nosocomial infections, acquired by a patient after admission to a healthcare facility. Infection control programs address proper aseptic technique, isolation procedures. Healthcare-associated nosocomial infections, acquired by a patient after admission to a healthcare facility. Infection control programs address proper aseptic technique, isolation procedures, education, management of healthcare-associated infections. Frequent hand washing, use of barrier garments and personal protective equipment, PPE, waste management of contaminated materials. Use of proper cleaning solutions, following standard precautions, using sterile procedures when necessary. Chain of infection. Components of the chain of infection. Pathogen, reservoir, portal of exit, mode of transportation, portal of entry, susceptible host. Please see box 4-1 in your textbook. Pathogen. Microorganisms that cause infectious disease include bacteria, fungi, viruses, prions, protozoa, and worms. Reservoir. Inanimate objects, as well as people, have various microorganisms. Pathogenic infections, numerous in healthcare environment. Portal of exit. Describes how pathogen released from the reservoir, body fluids or respiratory droplets. Mode of transportation. Direct contact, air, medical instruments, other objects, or other vectors. Portal of entry. Pathogen must have an entrance pathway into the susceptible host. Susceptible host. Factors: age, drug use, degree and nature of illness, status of immune system. This is the chain of infection. Healthcare-associated infection can be interrupted by infection control procedures. Breaking the chain. Hand washing procedures for sterile technique, proper waste disposal, appropriate laundry service, and housekeeping are ways of controlling the sources. Isolation techniques, control of insects and rodents, and use of disposable protective equipment and supplies help interrupt the modes of transportation. Host susceptibility controlled by speeding the patient's recovery. Immunizations, transfusions, proper nutrition, medication, and adequate exercise help the patient regain health. Standard precautions. Standard precautions. Standard precautions designed to decrease risk of transmission of microorganisms from both recognized and unrecognized sources of infection in hospitals. These precautions include universal precautions designed to prevent transmission of all infectious agents. These precautions provide protection from contact with blood, all bodily fluids, mucous membrane, non-intact skin. Infection control. Figure 4-4, please take a look. Airborne precautions. Decrease the spread of airborne droplet transmission of infectious agents such as rubella, varicella, and tuberculosis. Droplet precautions are used to decrease the transmission of diseases such as pertussis and pneumonia. These diseases can be transmitted through contact with eye, mouth, or nose secretions from sneezing, coughing, or talking. Contact precautions. Decrease the risk of infection to other patients and healthcare workers from diseases such as herpes simplex that can occur through direct or indirect contact. Use of standard precautions. Use personal protective equipment, PPE, to prevent skin and mucous membrane exposure when contact with blood or other body fluids of any patient is anticipated. Hands and other skin surfaces should be washed immediately and thoroughly if contaminated with blood or other body fluids. Hands should be washed immediately after gloves are removed. Take precautions to prevent injuries caused by needles, scalpels, and other sharp instruments or devices, during blood collection procedures, during disposal of used needles, lancets, and other sharp objects, when handling sharp instruments after procedures. Prevent infections from blood-borne pathogens. Use safety-engineered needles and sharps devices. Do not recap needles, purposely bend or break them by hand, remove them from disposable syringes or holders, or handle them for any reason. Prevent infections from blood-borne pathogens. Immediately dispose of the blood tube holder and safety needle as a single unit after blood collection. Place disposable syringes and needles, lancets, or sharp items after they are used in puncture-resistant containers for transport to a biohazard waste center. Must wash your hands. We all know the new way to wash our hands. You sing happy birthday or your ABCs twice, or vice versa. It is important to use a towel to turn the water faucet off. Gloves, how to put them on, how to take them off. We will be practicing this. Isolation for hospital outbreaks. To control the outbreak, the need for special precautions and isolation procedures might occur. Any healthcare worker entering or exiting these areas should be made aware of the special circumstances. Protective environment, reverse isolation. All food and articles are sterilized before they are taken into the patient's room. Protective environment, reverse isolation. All food and articles are sterilized before they are taken into the patient's room. Some patients must live in these protected environments when they are recovering from cancer treatments. Infection control in special hospital units. Infection control in a nursery unit. Newborns are easy targets for infections of all sorts because their immune systems are not fully developed at birth. Neonates may pick up pathogens from their mothers, other babies, or hospital personnel. Use gloves and an antiseptic for hand washing. Each bed. Infection control for compromised patients. Each bed is surrounded by a plastic curtain with sleeves. Hospital personnel use these sleeves to have contact with the patient. All supplies and equipment are kept outside of the curtain. Gowning, gloving, double bagging, and strict hand hygiene procedures should be used. All articles in the room, as well as the room itself, should be disinfected or sterilized frequently. Supplies required for isolation procedures: disposable gloves, gown, mask, protective eyewear. Here's an example. Personal protective equipment: A is the gloves, mask, and protective eyewear, and in figure B you have the gown. And they are putting the gown on, and they are using the straps to put on their mask. They have full coverage, and it is very, very important. Isolation item disposal. Isolation item disposal. Supplies needed: garbage bag, linen hamper, large red isolation bag, specimen container, plastic bag with biohazard label, laundry bag, puncture-resistant disposal container for needle and sharps, gloves, antiseptic agent or antimicrobial agent. Turn isolation bags halfway inside out and leave them near the door outside the room. Take only the needed supplies into the room. If collecting a blood specimen, use a tourniquet in the room or leave the one brought in. Label the specimen at the bedside and leave the pen in the room. Put used needles, swabs, and so forth in appropriate containers inside the room. Remove any blood on the outside of the specimen container with a paper towel. While standing in the doorway and touching only the inside of the isolation bag, place the specimen inside the bag. Wash gloved hands in the room and turn the faucet off with a paper towel. Removal of isolation gloves, goggles, or face shield, gown, and mask. Pull off the first glove, turning it inside out. Remove the second glove by slipping the first 2 fingers of the ungloved hand under the cuff of the remaining gloved hand and pull it inside out as the glove goes down the hand. Dispose of both gloves in a red garbage bag in the isolation room. After the removal of gloves, remove the goggles or face shields by touching the headband or earpieces. Do not touch the outside of the goggles or face shield because of contamination. Removal of patient specimen from the isolation room. Follow the required procedure for entering the isolation room. Label blood tubes as required and include isolation on the label. Collect the blood and place the tubes in a clean plastic biohazard bag outside the room. Complete hand hygiene. Transport the blood specimen to the laboratory with the appropriate laboratory request form. Disinfectants and antiseptics. Disinfectants are chemical compounds used to remove or kill pathogenic microorganisms. Disinfectants are generally used on surfaces and instruments because they are too corrosive for direct use on skin. Antiseptics are chemicals used to inhibit the growth and development of microorganisms, but do not necessarily kill them. Antiseptics may be used on human skin. Gloves and gowns should be worn when performing decontamination procedures. Please see Table 4-3 in the textbook. Fire safety. Fire safety is the responsibility of all employees. Be familiar with the use and location of fire extinguishers and the procedures to follow during a fire. Become skillful in and knowledgeable about the use of fire safety equipment. This is an example of a fire extinguisher and fire hose. Learn how to use fire extinguishers. Class A fires, wood, paper, clothing, and trash, require an ABC extinguisher or pressurized water extinguisher. Class B fires, liquids, grease, and chemical fires, need an ABC extinguisher or a carbon dioxide CO2 extinguisher. Class C fires are electrical fires, and a CO2, halon, or ABC extinguisher can be used. In Figure 4-35, we have an example of the proper use of fire extinguishers. Things not to do in the fire response. Do not block entrances. Do not re-enter the building. Do not panic. Do not run. Things to do in a fire response. Do pull the nearest fire alarm. Do call 911 or the hospital's fire emergency number. Do remove patients from danger. Do close windows and doors. Do use an ABC extinguisher for a small fire. Do leave the area immediately by stairs. Do drop to the ground and roll. Do crawl to the exit. Use of an ABC fire extinguisher. Pull off the fire extinguisher pin. Aim the extinguisher at the base of the fire and squeeze the handle. Spray the solution towards the base of the fire. Do not point it directly at an individual. Pull the pin. That's how you pull the pin. Safety points. Electrical safety. Safety points. Do not use power cords that are frayed. Avoid using extension cords. While collecting blood, avoid contact with any electrical equipment. Use 3-prong electrical plugs for all equipment. Example. Radiation safety. 3 cardinal principles of self-protection. Time, shielding, distance. Areas where radioactive materials are in use and stored must have warning signs. Nuclear Medicine Imaging Center. This is a radiation hazard sign. Chemical safety. Labeling is the single most important step in the proper handling of chemicals. Laboratory workers should be able to ascertain from appropriate labels not only the contents of the container, but also the nature and extent of hazards posed by the chemicals. This is a Department of Transportation hazardous material warning sign. NFPA rating system. The NFPA labeling system for hazardous chemicals. The system uses a diamond-shaped symbol, 4 colored quadrants, and a hazard rating scale of 0 to 4. Health hazard is shown in a blue quadrant. Flammability hazard is shown in a red quadrant. Stability hazard indicated in the yellow quadrant, and specific hazard shown in the white quadrant. Common laboratory chemicals require regulatory labels. This is an example of an OSHA-mandated labeling. Safety showers and eye wash station. The victim of a chemical accident must immediately rinse the affected area for at least 15 minutes after removing contaminated clothing. In case of a chemical spill in the eye, the victim should rinse his or her eyes at the eye wash station for a minimum of 15 minutes. Contact lenses must be removed before rinsing in order to thoroughly cleanse the eyes. The victim should not rub the eyes. Take the victim to the emergency department for treatment after his or her eyes have been rinsed for 15 minutes. Equipment and safety in patients' rooms. Provide privacy for the patient during blood collection procedure. Make certain that all specimen collection supplies, needles, and equipment are either properly disposed of or returned to the specimen collection tray after blood collection. Check on the position of the bed rails. Check for food or liquid spilled on the floor. Report a patient's alarm for the IV drip. If a patient is in unusual pain or is unresponsive, notify the nursing station immediately. Patient safety related to latex products. Symptoms of allergic reaction to latex may include a skin rash, hives, nasal, eye, or sinus irritation, and sometimes shock. Please see Table 4-5 in your textbook. In Figure 4-43, we have an example of a latex-free cart. In Figure 4-44, this is a latex-free environment sign. Disaster emergency plan. Healthcare workers should become familiar with his or her institution's procedures and must be prepared to take immediate action. Here's an example of a disaster plan and phone. We have reached the end of Chapter 4. Thanks for watching.